Oh yeah, sorry, this is Maruda. We're just going to demonstrate the
Good morning,
whatever.
Maruda. Dr. Fadke, Satish.
Yeah, hello, Dr. Farke.
Yeah, good
And
morning.
yeah, good morning. Good morning to all in the audience as well. Uh, so we're just carrying on with the ultrasound guided axillary block here. And this gentleman has got a rod put in his wrist, which is going to be removed. And we're just following up with the PNS stimulation yesterday.
Yeah.
I'm just doing a pre-scanning or scanning to show the anatomy and the relationship of the vessels and the nerves around.
Okay.
And we are going to see the relationship of the muscles as well.
Yeah.
All right.
What is the position of the hand?
The position of the hand, we can just show the hand position. So the hand is abducted,
Yeah.
90 degrees to the shoulder, and also flexed at the elbow 90 degrees.
Yes.
And externally rotated.
Yeah, we can see that.
You can see that. So that's a right hand. So position is like that.
Your orientation marker is on the lateral side, I suppose?
Yeah, the orientation marker is just facing to a cephalad.
Okay.
So that's cephalad. Can you show that?
That is the blue dot.
Yeah, the blue dot is the orientation indicator. Yeah, that is cephalad.
Correct.
Oh, and then towards the left of the screen is
we
patient's.
can see the pumping artery over there.
Yes, and towards the left of the screen is the right of the patient, and the right of the screen is the medial side of the patient.
Yes.
And the lower border of the screen is your foot end of the patient.
Yeah.
Okay, I'm just going to scan the vessels there, and I'm just going to use a bit of pressure. You can see the vein being compressed.
Yes. Yes. Yes.
Okay, yeah, that's the vein compressed, and the artery is just beside. I'm getting to the artery, and the nerves just surrounding the artery.
Yeah.
All right, we'll just scan and do that, and then I'm just scanning down
Okay.
to just show you the muscles.
Yeah. So first thing is you kept your vascular bundle at the center of the screen.
Yes, before you do that, yes. What I've done is I've increased the depth here to just show the muscles in relationship.
Yeah.
And, can you just show, yeah, that is the coracobrachialis.
Yeah.
Okay, and that white structure is the musculocutaneous.
Very nicely.
And these two heads of the biceps.
Yes.
All right, so keeping that, I'm going to reduce the depth now. Can we reduce the depth to? Fantastic. Okay, now we can see much better the musculocutaneous nerve. Yeah, and then you can see the vascularity, the artery and the nerve surrounding that.
Yes.
Okay, so what I'm going to do first is I'm going to use the local anesthetic before I infiltrate or give the ultrasound guided block to make the patient comfortable. So I'm going to use 23 gauge needle and lignocaine 1% and 2 ml syringe. Yeah. Can reduce the depth, please? Yes, lovely. So my approach to the needle is in plane. I'm taking the needle from the cephalad choroid. Sharp sting. Sharp sting coming here. Can you see the needle jiggling there?
Yeah.
Yeah, it's coming from the marker, yeah.
Yeah.
And I use the same thing to infiltrate the skin where I'm going to advance the. Can you see the needle there?
Yeah, it's in plane, so we can see.
Beautifully. That's through the coracobrachialis muscle there.
Yes.
So that makes it more comfortable
There
to
are
the.
two white structures in the coracobrachialis. One below seems to be a musculocutaneous nerve.
Yeah, that is the
What is the
musculocutaneous
one
nerve.
above that?
That is
Is it
the.
the facial plane? Or?
Yeah, intermuscular septae.
Yeah.
Sorry, Dr. Vishali. Yeah. So now I'm going to use my left hand because you need to be ambidextrous when you're using ultrasound. I'm using the 50 millimeter 22 gauge sonoplex needle.
Okay.
All right. So I'm going back and then scanning. And then bringing the musculocutaneous nerve to the middle of the screen.
Yes.
Can you reduce the depth further, please? I'm reducing the depth further because it's very superficial. That the whole screen depth is 1.8 centimeter. If you see the markers on the right side, it is half, 1.5, and 2 centimeters. So the dots here, can you just show the dots? Yeah, that's half.
Yeah,
1.
Can you shift the PIP on the left side? Yeah, yeah. Now I can see that
Okay.
total depth is 1.8 centimeters.
Yes.
Is it true?
Yes. And then, the dots on the right side is half a centimeter each marking
Okay,
there.
okay.
All right, so the depth is only about 1.5 centimeter. I'm just advancing my sonoplex needle.
So what is your sequence of blockade? First musculocutaneous?
Yes, musculocutaneous because much easier.
Yeah.
You can do whichever is comfortable for you
Hmm.
because that is very close by. I'm just using that.
Yesterday, the last block done, where very few people were here, actually was excellent demonstration by Bala about same block under
Yeah.
with the stimulator needle.
Yeah.
He demonstrated us how musculocutaneous is specifically to be blocked with the action of muscle contraction there.
Okay.
Many people miss that, but today we can compensate by doing that in a reverse manner rather.
Yeah.
We will
Yeah.
be blocking musculocutaneous first. Okay.
Yeah. Yeah.
Any particular
Any particular?
Will you please shift the PIP again on the right side because it is
Can you increase the
becoming
depth,
gray.
please? Increase the depth. Okay, that's good. Going. I'm just trying to get the, the. Okay, can you see the jiggling needle there?
Yes.
Okay, just going there, and then I'm just going to inject 1 ml there. Yeah, aspirate and inject 1 ml. Okay, can you see that nicely?
Yeah.
Okay, I'm just going beside. Yeah, 1 more ml, please. Okay, that's gone to the muscle. Okay, 1 more ml. Okay.
There is an additional advantage of observing the anatomy with sonography.
Yeah.
So whenever you are doing a block and sonography machine is not available, especially in our scenarios,
Yeah.
the anatomy gets fixed in your mind and one can try approaching the musculocutaneous nerve through coracobrachialis muscle. This is the way what I do rather than what it was shown yesterday by Bala. So the chance of getting a musculocutaneous nerve in the coracobrachialis muscle itself, direct puncture, then getting it, the chances are very high. Another thing is we can observe the different nerve components.
If I go out of plane, sorry? Yeah, just go out of plane and see.
Yeah.
Okay, I'm just trying out.
You are going towards the median nerve component.
Out of plane. Yeah, okay.
Yeah, that
aspirate.
Yeah, yeah,
1 ml. Yeah. Okay, can you see?
Yeah,
Yeah, nicely
yeah.
delineated. Okay,
I think,
so 3 ml around that.
yeah, you can see the injection going.
Yeah, another 3 ml. So what I've done now is I've just gone out of plane.
Yeah.
Okay, and then I'll come back, and then I'm going to scan back to the artery and look at the vessels there.
Yeah.
And then I'm going superficial and directing the needle to the artery.
Now you will go for the median nerve component first or
Yeah.
medial nerve component?
The one going behind. So, can you just show that? That's a radial. Yeah, that's a radial.
Yeah.
And that is the median, that is the ulna,
Yeah.
and then median is this side.
Yeah.
So if you give a local anesthetic before, then you can't advance to the ulnar now. So I go to the ulnar first and then come back and then give the median, then come back and go the radial.
Okay. Is it sometimes difficult to approach the radial nerve if it is lying exactly opposite of the artery in relation with your entry point? on
Uh,
the skin?
yeah, sometimes, yes, you know, you need to go behind and then do that. What I'm trying to do is I'm just going to get a nice good picture of the in-plane approach of the needle.
Yeah, that is.
Okay, so that is very superficial. I'm just directing it down now. Okay, can you see the needle there?
Yes.
Okay, I'm just coming down. Oh, sorry. Okay, I'll just, okay, can you just give 1 mil, please? Okay, there,
Yeah.
and then just going to advance further. Okay, aspirate 1 mil. Okay,
You
I'm
will
just going
try
to,
to go in between artery and the vein.
yes, yes, and 1 more mil. Beautiful. Yeah, 1 more mil, please. Beautiful. Okay.
Yes.
So we're just dissecting. This is called a hydro dissection. You can use local anesthetic or you can use your 5% dextrose.
Yeah.
I'm going a bit more further, and you can see the nerves nicely delineated there, beautifully there. Yes.
Yes.
Okay, the vessel is being pushed. Okay. Now, can you just show the median and ulnar nerve being pushed nicely? Now, the median and ulnar nerve being nicely separated and given there.
Yes.
Okay. I'm just going to give a little bit, another 3 mils there. Aspirate 3 mils. Okay. That's nicely, you know, given there for the median and ulnar. Total, how much we're given, Vishali? 10 mil? Yeah, we're given 10 mils there. I'm going to come back, and then I'm going to redirect the needle to the posterior aspect of the, for the radial nerve.
You will go behind the artery?
Yeah,
or-
behind the artery. So I'm coming back, and then going down. Okay, 1 more mil, please. Aspirate and 1 more mil, please. Oh, we'll bring it to the left, please. Yeah, we'll bring the picture to the left. Yeah, and 1 more mil, please. Okay, oh, aspirate, that's in the artery. Okay, see now what has happened is I tried to negotiate behind the artery and I've hit the artery. I can see the blood coming to the nerve, sorry, the cannula. I'm going to take it off and then flush it and then redirect it again.
Okay. Is it some minor vein which got?
Now I've hit the artery there. I'm going to give a pressure there,
Okay.
which this happens,
Yeah.
and then the way we're going to manage, you know, is what is going to routinely happen there. Can I have some gauze piece to press there, please?
Yesterday somebody was asking.
Yes.
Previously there was an approach that is trans-arterial approach.
Yes, you can do
Anybody
that.
uses a trans-arterial approach with the use of ultrasound?
No, I haven't heard anyone using a transarterial
Yeah.
using
I
ultrasound,
also have not heard that.
but we need to find from the audience or any expert guy you're using the ultrasound and using a transarterial.
Dr. Swarup, you have any experience? Dr. Swarup?
No, I don't go transarterial. Maruda,
Yeah?
can you just put a color on the artery and just show what actually happened on the vessel?
Okay, I'm just compressing. Okay, the vein is compressed.
Yeah.
The artery is still pulsating there. Yeah.
And
It hasn't expanded. There is nothing to show that there's any hematoma there.
yeah, and do you
But
think
it-
it's a good idea to actually, before injection, you put a color Doppler and just alienate?
Yeah, what happens if you put a color Doppler, the resolution of the screen changes. You can just put it off. You can see the change. Can you see the change in resolution?
Yeah.
Yeah. So that's why we don't put a color Doppler when we do the needling.
Yeah.
Okay. Now what I'm going to do is I'm just going to.
Satish, when you get a time, can you just update about yesterday's block, what actually happened, how the procedure went,
Yeah.
just for everybody's knowledge?
Yeah.
Thank you.
Dr. Sandeep is there?
Okay. So while having a chat, I'm just going to see if I can go in an out of plane approach. Okay, so that is where you're going to go there, yeah. Okay, yeah, aspirate. All right, see, now we just gone to the radial artery now, sorry, the radial nerve.
Yeah.
Vishal is going to inject some local anesthetic to see the hydro dissection there. Yeah, that's really pretty much there close. There is no blood aspirated. There's no hematoma there. I'm just going posterior to the artery.
Yes.
Aspirate and 1 more ml, please. Okay,
Uh,
aspirate. Yeah, finish it off.
in this case,
Lovely.
The
Okay.
nerve seems to lie exactly
Behind the artery,
so
yes.
will you change the direction of your bevel accordingly?
No, no,
You
we're
have
just going
fixed
to
this.
change the direction of the needle alone.
Okay.
So what we've done now is, we injected the musculocutaneous first. They went above the artery. They been injected to the ulna.
Yeah.
Then we injected for the median nerve. And then I tried to inject for the radial nerve.
Okay.
Then I punctured the artery, pulled it out, gave pressure, and then we did for the radial nerve back now.
Yeah.
And it's pretty much done.
Yes, yes, yes.
Yes, thank
We
you.
could see all the three injections.
Yeah, you can see the anatomy. It isn't easy. It's superficial, but unfortunately, this difficulty happens. And then we came across arterial puncture, and then we used some pressure, and then we came back, and then we did the radial nerve again.
Sometimes there is a variation according to the tissue resistance
Yeah.
in different patients.
Yes,
Is that true? So the manipulation of needle may look different in different patients.
yes, that's. But usually, only the muscle plane is going to be thick here.
Yeah.
There is no other thick structures or the ligaments we are going to go through.
Yes.
So there shouldn't be any difficulty unless if the patient is too muscular. This patient is nicely muscular. You could see that the coracobrachial is, yeah.
Maruda, you
Yeah.
have time. Can you just quickly show the actions? Can you check the action and please show everybody?
You want to show the action? Okay.
Yeah, please.
Action of
All right. Okay.
So what are you planning? What do you want to present?
Okay. Do you want to pull? Ask him to flex it. Yeah. Ask him to pull. See. Yeah. See that? I'm just using my one finger. He's not able to pull. Okay. That's all he can pull. So that is for and then no. And then I'm asking him to push out for the radial nerve. See that? Okay. And that's for the median. That's for radial. Okay. And I'm going to pinch. Do you feel anything there?
Hello?
Do you feel there?
Yeah, we could see. It is
Yeah, I'm just trying to pinch. Okay. So he could feel more on the right side than the left side, but he can still feel the sensation of touch. But he's weak.
What was the total volume injected?
Total volume I just gave 9 plus 3, 12 mils. Yeah, I didn't go more than, usually when you give a peripheral nerve stimulator, you use about 20 to 30 mils, because now we're going to inject very close to the nerves, we identify the nerves, so just giving it for 13 mils. Thank you. I think we're going for the next one.
Okay, thank you very much, sir.
Yeah, hello? Yes, so thank you. Can you switch it off?
What is the next plan there? What is lined up?
I think that, I don't know what they're doing next. They're all ready. Can you just put some pressure?
Hello.
Hello?
Hello, Dr. Pandey.
Yes, Sandeep.
Yeah, we are going to proceed with the femoral stimulating catheter with ultrasound.
Okay.
And there will be a single shot obturator nerve block to be demonstrated by Dr. Sanjay Sinha.
Yeah, is there any time before Dr. Sinha starts? Because Swaroop wanted to show some anatomical slides. Is it
I
possible?
don't think so. It's quite
Okay.
difficult. We are very much squeezed in.
Okay, fine. If time permits, we'll in between, but otherwise we'll start. You can start right
Yeah,
away.
we are starting right now.
Okay.
Thank you.
Swaroop, can we postpone maybe a little bit in between? Yeah, thanks.
Okay, can you raise the whole bit up?
Hello?
So, hello. Hi, this is Sanjay Sinha. We are going to do a continuous femoral catheter, a stimulating catheter with ultrasound guidance as well as stimulation.
Good morning and welcome, Dr. Sanjay Sinha.
Good morning, good morning. So we've already prepped and draped, and we have put the, enclosed the transducer in a sterile sleeve. We have some sterile gel, and we're all set up to proceed. So I'm going to start scanning in the inguinal area, and you can see the femoral vessels over there, the femoral artery, and right next to it you see that teardrop-shaped hyperechoic structure.
Can we get the sono picture on the screen?